Hey everyone, and welcome back to the MediByte channel, where we break down complex health topics into clear, easy to understand explainers. As a healthcare professional, I see patients dealing with our topic today all the time, and honestly, they're often carrying so much unnecessary worry and confusion. So, we're going to dive right into the fascinating world of bacterial vaginosis, or BV. It's an incredibly common condition, and trust me, having the actual medical facts can absolutely make all the difference.
Here is our roadmap for today. We'll be looking at 1. What is bacterial vaginosis? 2. Causes and common myths. 3. Identifying the symptoms. 4. Diagnosis and complications. And 5. Effective treatment options.
All right, let's jump straight into Section 1. What is bacterial vaginosis? Demystifying the condition. To really get what BV is, we first have to understand the vaginal microbiome. Basically, this is the natural, balanced ecosystem of various bacteria that reside right there in the vagina. You can actually think of it like a perfectly balanced garden. Just like a really flourishing garden needs very specific conditions to thrive, your body relies on a specific balance of bacteria to stay healthy and, ward off infections. BV fundamentally just comes down to an alteration in this delicate little ecosystem. When we look at a healthy ecosystem compared to one with BV, the shift is super clear. In a totally healthy environment, you've got a high number of protective bacteria called lactobacilli. Think of these as the good guys. They're the ones maintaining normal acidity, which keeps the whole area healthy. But when those protective lactobacilli drop, well, it basically opens the door for the weeds of the garden to take over. We're talking about bacteria like Gardnerella and Peptostreptococcus. This overgrowth throws off the normal acidity, and honestly, that exact bacterial shift is exactly what bacterial vaginosis is. Moving on to Section 2. Causes and common myths, separating fact from fiction. Okay, I really want to clear the air here because there is so much stigma and misinformation out there. Let me reassure you with this core, absolutely crucial medical takeaway. BV is an imbalance in your bacteria. It is not an STI. This is literally one of the most common misconceptions I hear. It can happen in people who have never been sexually active or maybe haven't been sexually active in a long time. The bacterial shift just happens on its own. It's not something you catch from someone else. Now, having said that, there is a bit of a nuanced connection when we talk about sexual health. While it's not an STI itself, BV is definitely associated with some aspects of sexual activity. For instance, having a current sexually transmitted infection is actually a known risk factor for developing BV. And it goes the other way too. Having BV makes your vaginal environment way less protective, which actually increases your risk of acquiring an STI if you happen to be exposed to one. Basically, the two environments heavily influence each other, which is why staying on top of your overall vaginal health is just so important. Let's look at Section 3, identifying the symptoms. What to look out for. So how do you know if your body's ecosystem is crying out for some help? Well, the most distinct signs are a thin, yellow-green or gray vaginal discharge, usually accompanied by a really strong fishy odor. And you might actually notice that this odor gets noticeably worse right after sex or during your period. But here is something super important to note. Typical infection signs like itching, redness, or swelling are actually really uncommon with BV. If you're dealing with severe itching, you're probably looking at a completely different issue like a yeast infection or maybe trichomoniasis. And that's exactly why getting a proper clinical diagnosis is key.
Which brings us perfectly to Section 4, diagnosis and complications. Why seeing a doctor matters.
Listen, if you've got an unusual discharge that's hanging around for more than a few days, it's time to see a healthcare provider. And honestly, there is zero reason to stress about the visit. It's incredibly straightforward and completely routine. Usually, it's just 4 simple steps. First, your doctor is going to evaluate your symptoms. Second, they'll do a standard pelvic examination. Third, they just take a quick, small swab sample of the discharge. And finally, they look at that sample under a microscope. By looking right at it, they can quickly confirm the overgrowth and rule out anything else. Super simple, right? But treating it promptly is a big deal because if you just ignore it, BV is associated with some pretty serious potential complications. Untreated BV can actually lead to pelvic inflammatory disease, or PID. And if you're pregnant, the risks are particularly significant. Things like intra-amniotic infection, which affects the membranes around the baby, and even a higher risk for preterm labor and delivery. It can also cause infections of the uterus after a delivery or an abortion. So yeah, taking it seriously is all about protecting your long-term reproductive health. Finally, Section 5, effective treatment options, restoring the balance. The really good news here is that medical intervention is highly effective.
Treatments basically involve targeted antibiotics that go in, clear out that bacterial overgrowth, and let your protective lactobacilli bounce back. You've got oral pills like metronidazole or secnidol, and actually, secnidol is incredibly convenient because it's just a single dose. Or your doctor might go with a vaginal gel or cream containing metronidazole or clindamycin. In fact, doctors often prefer these localized creams when they're treating pregnant women.
Now, here is an incredibly important caveat you absolutely need to know. If you end up using the clindamycin cream, it actually weakens latex products. Yes, that means things like condoms and diaphragms. So, while you're busy treating the BV, your primary barrier methods for birth control and STI protection might actually be compromised. Definitely keep that in mind and chat with your doctor if you normally rely on latex products. Just to wrap up the treatment side of things, here are a few fast facts. Your symptoms will usually clear up pretty rapidly, often within just a few days of starting the antibiotics. But recurrence is really common. That little ecosystem can be pretty stubborn. If it keeps coming back, you might actually need weeks or even months of antibiotics to finally get things stabilized. And hey, remember earlier when we said BV isn't an STI? Because of that, treating your sexual partners is generally not recommended, unless of course your own treatment just keeps failing. So what does this all mean for you? Well, it brings us to a final, pretty empowering question. Are you listening to what your body's delicate ecosystem is telling you? Are you ready to take charge of your vaginal health? Your body has this incredible way of signaling when its natural balance is off. And there's absolutely no shame, none whatsoever, in seeking medical care to help hit the reset button on your microbiome. Thank you so much for joining me for this explainer. I really hope you now feel fully equipped with the knowledge to understand and confidently address bacterial vaginosis. Please remember to like, share, and subscribe to the MediByte channel for more empowering, non-judgmental, and totally medically accurate guides. See you all next time.